If you remember way back, the World Health Organization, in talking about third world countries, places like Africa that have huge populations, but of course lower resources in terms of hospitalizations, the quality of care, of course, in places like Africa is obviously not as good as in places like the West. And of course, the World Health Organization was basically sounding the alarm back in May of up to 190,000 people could die in Africa, of course, if not controlled. It says here that 100 up to 190,000 people in Africa could die, and 29 million to 44 million could be infected within the first year alone. And of course, they went on to state things like the predicted number of cases that would require hospitalization would overwhelm the available medical capacity in much of Africa. There would be an estimated 3.6 million to 5.5 million hospitalizations, not cases, but hospitalizations, of which 82,000 to 160,000 would be severe cases requiring oxygen, and 52,000 to 107,000 would be critical cases requiring breathing support. Such a large number of patients in hospitals would severely strain the health capacity of countries. And of course, now looking forward, this was back in May. And of course, an article published here by the American Association for Advancement of Science. And of course, it basically recaps what's been going on in places like Africa, where Africa, if you look at Africa, has a population of 1,350,000,000 people, right? So that is a huge population. And so what has been the outcome? These are things, of course, that is not typically discussed in the news outlet and the news media in terms of what is going on within these countries, where there were estimates of overwhelming numbers of people that were going to be infected, and yet we really don't hear much about what's going on in Africa. So let's take a look. And so looking at this article titled, "The Pandemic Appears to Have Spared Africa So Far, Scientists Are Struggling to Explain Why." As it goes on to say, it says, although Africa reported its millionth case last week, it seems to have weathered the pandemic relatively well so far, with fewer than one confirmed case for every 1,000 people and just 23,000 deaths so far. Yet several antibody surveys suggest far more Africans have been infected with the virus, a discrepancy that is puzzling scientists around the continent. It says, we do not have an answer. And this, of course, is by an immunologist from the Kenya Medical Research Institute of Wellcome Trust Research Program. And it goes on to state that of the 3,000 blood donors, it says that they estimate that about 1 in 20 Kenyans from the age of 15 to 64 have antibodies. And of course, that would, as it says here, it says that would put Kenya on par with places like Spain, and of course, in mid-May. This is when that country was descending into its peak. As it says here, Kenya's official toll stood at 100 when the study ended. And it says, and Kenya hospitals are not reporting huge numbers of patients with symptoms. It goes on to state here that that their study concluded that about 12.3% of them had been exposed to the virus. It says, based on the findings, it says mortality ratios for the virus elsewhere, it says they estimate that the report number of deaths in the region at 17, of course, which was 8 times lower than expected. It says scientists who surveyed about 10,000 people in the northeastern cities of Nampula and Pemba in Mozambique found antibodies for about 3 to 10% of the participants. It says depending upon the occupation, individuals such as market vendors, of course, had higher rates, followed by healthcare workers. Yet in Nampula, a city of about 750,000, a mere 300 infections have been confirmed at this time. Mozambique only has 16 confirmed and 19 deaths. 16 confirmed deaths. And then, of course, a microbiologist and epidemiologist with the epicenter Africa, the Research and Training Armed Doctors Without Borders, says he found a high prevalence of antibodies for the virus in people from Cameroon, says a result that remains unpublished. I wonder why. It says, so it explains the huge gap between the antibodies. And what they basically talk about is that they don't really have a huge portion of testing. As it says here, 1/10 of the rate of Spain in terms of testing. This is places like Nigeria, says the continent's most populous nation, tests 1 out of every 50,000 people per day. It says even many people who die may not have a proper diagnosis. But then it goes on to state, but in that case, you would still expect to see a rise in mortality, which Kenya has not seen. And so the article concludes basically, if tens of millions of Africans have been infected, it says that raises the question of whether the continent should try for herd immunity without a vaccine. It says maybe Africa can afford it given its apparent low death to infection ratio. It says we need to dig into that. Of course, like I said previously in my last article, that more than likely what is affecting the outcome of what's going on in places like places like Africa is typically related to the age range, as the medium age in places like Africa is lower. As you can see here, in places like Spain, the medium age is 45, but the median age in places like Kenya and Malawi is 20 and 18 respectively. So as it says here, it says young people around the world are far less likely to get severely ill or die from the virus, and the population in Kenya cities where the pandemic first took hold, it says skews even younger than the country as a whole. Right, so this is what is important to have this kind of information. When you have this kind of data, if this information was actually released to the public, then you would see a lot less people, of course, being fearful and having, wondering whether they need to mask, whether they need to wear masks, social distancing, etc. But unfortunately, this isn't the sort of information that we basically have access to. You actually have to go digging for it on the internet. But it's interesting to find out that even in places where it was projected they would have tens of thousands of people who would die and millions of people would be seen in the hospitals, this, of course, has not been the case.